Hello, I'm Adam Fleming, SBT. Alongside me is Valerie Vorndran, SBT, and today we're going to be talking to you about cystic fibrosis. So let's get into it. Let's discuss what cystic fibrosis is. Cystic fibrosis is a genetic disease that affects the lungs, the GI system, and the pancreas, specifically the cystic fibrosis transmembrane conductance regulator gene, often abbreviated the CFTR gene. So this gene, the CFTR protein, allows chloride ions to exit from mucus-producing cells in the lungs and the pancreas. And we all know that when chloride leaves, when ions leave, water follows. So that's going to thin out the mucus that is produced. And in this protein, the CFTR protein, doesn't allow chloride ions to leave mucus-producing cells, so it just gets trapped in. And since the chloride's staying in, more water stays in, and then this mucus becomes sticky and thick. So these passageways become clogged. So CF, as I touched on, is a genetic disorder. It's classified as an autosomal recessive disorder. It's usually congenital. We all know Punnett squares, how that works.
Okay, so CF affects a person in many different ways, almost a lot of systems in the body. Mostly the respiratory tract. You're going to see thickening of the alveoli and obstruction of the bronchioles by mucus, and that can lead to infection like pneumonia, also pulmonary fibrosis, and various other pulmonary infections. The most severe can be pseudo and staph. Your cardiovascular system would be affected. It's going to decrease the aerobic capacity of endurance and impair your circulation. Musculoskeletal is going to be affected as well. You're going to see decreased strength, flexibility, also bone density. Their GI system would be affected, blocking the pancreas, as we said before, also the salivary ducts, and it's going to affect nutrition, your digestion, and absorption quality. Lung function, we kind of talked about that. It's going to block the diffusion capabilities, and also you're going to see pelvic floor incontinence associated with the constant coughing that these patients will be doing, and also your integumentary. It's going to block sweat glands and sexual function. Most males are going to be sterile, and some females will be infertile.
So now let's discuss the prevalence and the characteristics of cystic fibrosis. More than 30,000 people worldwide are living with cystic fibrosis. Like it says on the screen, there's 70,000 plus worldwide cases. There's about 1,000 new cases every year, and about 75% of people with cystic fibrosis are diagnosed by age 2. And then when it comes time, lung disease is the primary cause of death for about 80% of individuals with cystic fibrosis.
Right, so the way that we'll treat, or not us, but doctors, physicians will treat CF pharmacologically would be mostly they want to prevent infections. And then once an infection is in the lungs, they're going to use antibiotics, oftentimes inhaled or oral. But as therapists, we need to take care to prevent the spread of disease via equipment and ourselves or other patients. And this maintenance column you'll see on the left here is focusing on maintaining airway patency as much as possible. One antibiotic that has shown some promise is erythromycin. It's an antibacterial drug with anti-inflammatory as well as immunomodulating properties. You'll also see these patients on systemic glucosteroids, right? Such as prednisone. This can limit airway inflammation, improve lung function, but you have to be careful that the benefits outweigh the risks, especially when taking these long-term, especially in children, and that's what the CF population you're going to see. As therapists, we want to look for the breakdown in skin and be careful not to overstress bones and musculotendinous structures. Inhaled glucosteroids are limited because they can't penetrate that thick mucus in the lungs with people with CF. And then you'll also see bronchodilators and mucolytic and expectorant drugs, which is going to help limit the formation of the mucus. And then there's also the deoxyribonucleic clinase. It's an enzyme that is inhaled to break down large quantities of DNA that are present in these respiratory secretions. This DNA finds its way into the mucus, into the airways, because when inflammation or inflammatory cells are destroyed, that DNA gets deposited into the airways lumen, and the DNA increases the viscosity and thickness of these respiratory secretions. And that's one way to break that down. So the non-pharmacal treatments that you're going to see, are daily respiratory hygiene, just keeping them healthy. Postural drainage, that's changing a patient's position to get that mucus down from the depths of the lungs. Breathing exercises, of course, you're going to be working with them, trying to get that mucus up towards the top. You also see kind of aerosol therapy to the lower respiratory tract, should be given to before airway clearance techniques to maximize both of the treatments. You also want to plan these non-pharmacological treatments with their respiratory therapy treatments. That way that they can have a more beneficial effect. There's also lots of devices designed to help move mucus up the airway so it can be coughed out, including autogenetic breathing, PEP devices, and flutter devices. And you'll see a picture of that flutter device right there at the top right. There's also high-frequency chest wall oscillating vests, which you'll see in the bottom, and that provides mucus clearance for patients who lack the ability to do it themselves. And it's good for kids. It's expensive, but if you think about the cost of going to the hospital with an infection, it's actually a pretty good treatment technique.
All right, so now we have a couple studies that have looked at physical therapy-related topics in cystic fibrosis. So this first one is I found, it's from Trusters from about 2004. And they looked at 64 patients in a Belgian hospital with CF and compared them to 20 control patients without CF. And they looked at a whole bunch of different isometric values and just standard VO2 max type of values for with exercise. And they discovered that CF patients, as you can see on the left, when they looked at quadriceps predicted values just isometrically, you can see that CF patients have a much lower result compared to control patients. And then on the right is a huge chart based on different, topics that were talked about: quadriceps strength, hand strength, 6-minute walk, predicted values and actual values, and then highlighted in yellow there is the VO2. And you can see that the control subjects were all much higher, and statistically p-values were very, very low, showing that skeletal muscular force and exercise capacity in patients with CF are much lower than control patients.
Nice, AJ. And I looked at a study that had talked about the prognostic value of exercise testing in patients with CF. It was a randomized controlled trial with 108 subjects. They looked at an 8-year survival rate of the two groups of patients with CF and compared their aerobic exercise fitness levels between the two groups. They controlled for many factors, including age, sex, nutritional status, pulmonary function, bacteria colonization of pseudo, because people with pseudo have a worse prognosis. They also controlled for end-tidal partial pressure of carbon dioxide at peak exercise. They found that aerobic exercise training improves aerobic fitness, obviously, but people who were more aerobically fit decreased the fact of lung failure and had a better prognosis, and also were still alive after that 8-year mark in this study. And here's a graph kind of showing the survival rates. You'll see at the 8-year mark at the end here, people who are high fitness versus medium versus low, you can see that they had a better survival rate due to that aerobic fitness level. And then CF relates to the top 20 in a few ways. First off, it's going to affect the diffusion capabilities of the lungs. That mucus buildup is going to block the diffusion of oxygen and carbon dioxide across the capillary beds in the lungs, especially the bottom of the lungs. And then it's also an obstructive disease because of the mucus, again, is going to block the airways. But CF is kind of unique in that it's also a restrictive lung disease. That fibrotic element is going to develop and superimpose on that obstructive lung disease, causing all sorts of problems for the patient. Thanks, guys.
Woo!